Well, welcome back once again, everyone. My name is John Leatherman, and welcome to our CAPE training program. My partners in this project, importantly, Mark Skidmore, Director of the North Central Regional Center for Rural Development, Rosa Solis McKelvey, Communications and Logistics Coordinator, as well as Paula Miller, our CAPE postdoctoral fellow. First of all, CAPE. CAPE is Community Assessment and Education to Promote Behavioral Health Planning and Evaluation. Our project co-sponsors include the Substance Abuse and Mental Health Services Administration, the U.S. Department of Agriculture, and the USDA Regional Rural Development Center Network. The partnership is intended to identify and disseminate more effective response strategies to the challenges of mental illness and substance abuse within our communities. Our training objectives are twofold. They are first to enhance behavioral health literacy and reduce mental health stigma within the communities, and to do so we draw upon the mental health first aid training program that you've previously taken part in. Our second objective is to encourage the formation of community coalitions to respond to behavioral health challenges. And to do so, we are utilizing this training program, discussing community development and organizing community scale initiatives. Here today, we're going to be discussing assessing community preparedness for engaging in a broad community initiative. And thereafter, we have a couple of videos that will discuss engaging the community and building community consensus. And then we talk about strategic action planning, where we focus on the objectives that you've established for your own communities and how you'll undertake an initiative to respond to those. Here today, we'll discuss essentially some ideas with regard to what makes for more versus less successful communities. We'll talk about identifying and defining the scope of the issue that we'll be dealing with, identifying essential stakeholders to our project initiative, doing a community asset inventory, as well as considering available data and history within the community. Now, first of all, just some thoughts with regard to successful communities. And this really motivates and informs exactly how and why I've organized our program the way I have, insofar as I believe that there are certain essential elements to successful communities. And I've given this some thought over quite a little bit of time. And indeed, I came to this conclusion really fairly early on in my career when I was working as a county extension agent. And I wondered to myself why the communities within which I worked were so different, some much more vibrant than others. And I thought about what are the factors that are really leading to this. And I won't suggest that I have the answers to it, but I do think that I have some elements that are important that I believe have been validated in my own mind time and again over the course of years. First of all, successful communities combine effective leadership and as well as multiple effective organizations to develop networks. And within those communities that have a greater density of networks, we tend to see that there's more action that occurs. And where such a situation exists, the collaboration that the networks essentially represent tends to lead to greater outcomes than any single organization or individual could accomplish on their own. Now, looking at this a little bit more closely, as we consider one of the essential elements in my own mind, leadership. An effective leader is really an individual who can think very broadly about the community, can communicate their ideas very effectively, and tends to be open and non-defensive. And I've seen many times where we have very capable leaders who tend to be turf conscious, and in such instances, that does not lead to an effective network development. We also have our second essential element, organizations, where we have a larger number of active and effective organizations. We have the elements necessary for success. Now, when you bring these together, you create a network of individuals and entities, and where we see a greater density of these types of networks, we have a circumstance where there are more people who are engaging in greater levels of communication and sharing. There's a greater level of understanding and agreement with regard to community priorities, and there's more mutual assistance that can be had. And where we have a circumstance where all of these elements are together, and we have these dense and active networks, we tend to see good stuff happening within these communities. Maybe not always as planned or intended, but in general, we see greater vibrancy. We see new leaders stepping up as needed. We see more business activity occurring. And so this really is what I am trying to foster, is this notion of creating these networks that can be more effective in pursuing community level goals. Now, it all starts with clearly identifying the scope of the issue that you're trying to deal with. What needs to be accomplished? Articulating the scope of the issue, whether the focus is very broad in its nature or whether it's relatively narrow. We need to articulate very clearly what needs to happen, what we want to be able to accomplish by way of enhancing awareness and knowledge, engaging people in different types of behavior, or the establishment of various kinds of policies. We need to also very clearly articulate the relevant community that we're dealing with, whether that be a city, whether it be an entire county, or whether perhaps it would be an entire region for what we would hope to accomplish. Then what we need to do is identify the essential stakeholders. Now, community behavioral health stakeholders would be those who perhaps are more directly involved, such as the hospital, the mental health services agency, the health department, various types of shelters or other agencies, and perhaps even various state or regional health service providers. More tangentially involved individuals to behavioral health challenges might include local law enforcement, the police department or sheriff's office, the county jail, city and county leaders, and other major entities and institutions. Our other interested and affected stakeholders might be members of the business community, the educational system, faith-based organizations, civic organizations, media, various types of elder and youth services. Now, here's an example of some networks, organizational intersections that exist here in my own home county of Riley County. The Mental Health Task Force is membership includes individuals from the mental health agencies, public health, private health, the law enforcement agencies, local government leaders, faith leaders, business connections, as well as military and educational institutions. Another example is the Riley County Council of Social Service Agencies. And I note that much like the Mental Health Task Force, as I review sort of their activities and their agendas, it tends to be a very fluid kind of an agenda that they pursue without great expectations. Really, it's a matter of bringing people together to talk and to share what is going on within their own institution, to discuss community needs and think collaboratively about responding to those needs, and then to engage in collaboration where it makes sense for an individual entity or organization. From there, we need to sort of give some consideration to what all of the stakeholders are doing. What are their stated priorities? What's their mission? What are their current activities? And indeed, as we consider it here in Riley County, Kansas, as I sort of review a number of the key stakeholders, the Regional Mental Health Services Agency lists the various kinds of services that they have on their internet website, community-based services for children and adolescents, community support services for adults, crisis services, and so forth. We consider what sorts of activities the local hospital is engaged in and the kinds of services that they provide, dealing with depression, anxiety disorder, and a variety of these other kinds of mental health services. Our county health department identifies what its priorities are. Private mental health service providers do so the same. You can find this information on the internet, and the notion here is really to just understand what exists, what's going on, what are the various kinds of stated priorities that various institutions have, so that we can be knowledgeable and responsive to those needs that our partners would identify. One of the things I like to do then, after having sort of taken stock of what exists, is ask myself the question of what's not there that's needed. That's a fancy term for a fancy way of, we can call it a gap analysis, but really it's just a matter of asking the question of what's not present that may be needed, and that may inform the kinds of priorities that we identify. We might, for example, identify the fact that we need some sort of a crisis center for short-term detoxification or stabilization. We might need perhaps a women's and family shelter for those who are subject to domestic abuse, other kinds of self-help therapy groups. All of these things may be examples of that which may not exist, but which could potentially be beneficial to our community. From there, we really want to do a little bit of digging to understand the history that's preceded our current initiative and understand just generally the needs that exist within the community. First, once again, and reflecting back on our earlier webinar, we want to take a look at the various kinds of objective data resources that exist, whether there might be some sort of area health resource profiles available. Consider the data that's available in the behavioral risk factor surveillance system. Perhaps consider other kinds of information resources from Center for Disease Control, for example, and consider whether or not there might be some unique local data that would be available to inform us. From there, we want to take a look at, basically look back at previous initiatives that may have occurred, and indeed when I first began working on behavioral health issues here in Riley County, lo and behold, not a year earlier, a very comprehensive community needs assessment had been undertaken, and one of their primary conclusions was that within the midst of growth and general prosperity, there's an invisible population with significant needs, including accessible and affordable mental health services. And indeed, that's a very powerful statement that sort of justifies our initiative and our activities, and indeed has helped propel the work that we've been doing here in Riley County. So just to wrap up for now, essentially, we'll continue our discussion in the next video. Looking at community preparedness, we'll talk a bit about leadership analysis, public relations, use of social media, and then we'll take another look ahead. So with that, here is our contact information for both myself, Mark Skidmore, Rosa Solas McKelvey. Please feel free to be in touch with us should you have any questions or comments, and indeed I'll be happy to work with you on the development of your own community strategic action plan. So feel free to contact me, and I'll look forward to visiting with you in our next video. Thank you.